Victory, your host of Fertility Fact or Fiction, the best and I think now biggest show on the web for all things fertility. So welcome to our show. Tonight we have our Commander-in-Chief Tarek, all the way from Istanbul, staying awake at 3 in the morning to help us out. And you gotta wake up, actually by the time this is done, you gotta get up and fast, don't you?
I decided to be rogue and fast. You're absolutely right. That is the move I made.
What time does the sun rise there, do you know?
Rumor is cutoff time for eating is 5:10, so I got an
Oh, so
hour.
you finish this, you eat, you pig out, and then you can get some rest.
That's right.
That's good.
My meeting's
Except
at 10:30 though, so that's kind of
now, does the hotel accommodate the fasting schedule? Like, will they feed you?
there is a early breakfast during Ramadan in Turkey. Yeah.
Oh, that's wicked. See,
Yeah.
that's great. I love it. Cool.
Yeah.
Excellent. Well, we are lacking any good studies. Again, there has been no good studies for a long time on any of the journals that I look at. I've even started exploring other journals to see if there's anything good. There's very little that's like exciting out there. So nothing too tremendous happening. Nothing really mind-blowing coming along. We are getting involved in doing some research with the company that thinks they may have solved the problem with aneuploidy, genetically abnormal embryos, even for women who are older. So that's up and coming, and we're very excited about that. But aside from that, nothing tremendous. Our St. Catharines location should be open in about a month and a half, 2 months. And we're working on our other location. I need a builder with some common sense because the last guy had no clue what he was talking about. So, yeah, that's us. And we're open to questions. I don't know if you have questions from before or if people have already started jumping on. I'm not seeing the questions come up here.
Yeah, no, they're on Instagram. We got a lot of questions on Instagram. But did you want to give a couple seconds to talk about the Beyond Fertility program?
Oh, yeah, sure. So there's a Beyond Fertility Summit with a whole bunch of fantastic speakers. And they invited me to be part of it. So I was really honored to be a part of that as well. So I did a talk with their kind of founder and commander in chief, so to speak. And we were discussing all sorts of different things about fertility protocols, naturopaths, integration, better care, all that stuff. So if you guys want to check that out, they have all sorts of links to a variety of different talks, things about oxytocin, how you improve your preconception health, how you manage your fertility. So Tarek's going to put up the link, and I think there's going to be a QR code as well.
Yeah, it's right above your head on the left-hand side, or on your right-hand side on the screen right now. There's a little QR
Okay, I
code.
can't see any of that. I just see all
Okay.
my cars above my head. But yeah, so for sure, click the link, scan the QR code, check that out. There's links from there to a bunch of variable talks and presentations. So please go there, check that out. And T, you're going to leave that up the whole show, or?
Yeah, I can leave it up for the whole show. That one's
Yeah,
always
no problem.
available.
That would be
Yeah.
great. So people can check that out, and we'll put it up on our Instagram today and tomorrow and so on. So that should be good for everyone to have a look at.
Yeah.
I also found a new tea,
Oh,
blueberry green tea. It's
you're,
really
ex-
good.
you're experimenting without me. That's what
Yeah, I
happens.
know. I feel bad, but it's very, very good. I see some questions, so fire away.
Okay, let's go to Instagram. Those ones came in a little bit earlier. Um, if my fertility doctor refuses to treat my urea plasma, can I get a referral to you just for that?
Um, yeah, but I mean, that would take forever. Just go to your family doc and say, I want to be treated for urea plasma. I've got this infection. I wonder if this is the same person that asked about it last time. How on earth could a doctor think that it's okay to have urea plasma? Like, it just doesn't make sense to me. So, yeah, by all means, you're welcome to come to us. I'd probably just have you talk to my nurse practitioner who would be happy to take care of it. And that way you don't have to wait forever. So, yep, not a problem at all. Happy to do that. Get a referral to us. Tell them you want to see Kasha, and they'll set you up.
So just to mention, just because some people are asking on TikTok that there is no QR code, the QR code is only going to be on Facebook, YouTube, Instagram,
Oh, right.
and
We
Twitter.
can't put it up on TikTok. Yeah, so it's on Facebook, YouTube, Instagram, X, formerly known as Twitter. Yeah, we can't put it on TikTok. Sorry, guys. But we'll put it up tomorrow.
We'll put
We
it
can
up.
make a
Yeah.
post on TikTok, right?
Throughout the week, we'll highlight some of the good mentions that's going on there. So there'll be a couple of links throughout the week for people to watch as well.
Okay, great.
So don't worry, guys. We're
Yeah,
not going to leave anybody behind.
we're on. No egg gets left behind. We're the fertility Marines.
That's right.
Yep.
I've done 3 months of Lupron to treat endo. The plan is to do a fourth shot, which would be about a week before FET. What are your thoughts, risk benefits associated with this protocol?
So it was just Lupron?
Fourth shot Lupron, yeah, to treat endo.
So Lupron by itself prior to FET has been proven to be useless. So we don't advise people do that. We always tell them to use Lupron with letrozole, which has been proven to be useful, but Lupron alone is not that useful. Yeah, so a fourth month will not help you because the first three didn't either, unfortunately. So if you're going to do it, add in letrozole 5 milligrams daily, do it for another 2 months, and that will be beneficial for you.
How many cycles on letrozole until you suggest something different?
That depends on what the diagnosis is. So, assuming they're talking about just like for PCOS, three minimum, six maximum.
What size should majority of follicles be at trigger for IVF?
Well, the research suggests that it's kind of age dependent, but generally speaking, somewhere between 16 minimum to about like 22 maximum.
Hey, Dr. VNT. First IUI on Thursday. Woo-hoo. Two questions. That was my best impression of a hoo hoo.
That was a good woo woo. Yeah.
Thank you. Number one, first question. Who does the procedure, you or my nurse? And number two, will I be okay to work the day after?
I don't do IUIs. Anyone can do an IUI. So my nurses do them and they're very good at doing them. They only get me when it's impossible to get through the cervix. And so you will get my nurse, but they do all of them and they're very good at it. That's not a problem. Will you be okay to work the day after? Absolutely, 100% you will be.
Hello, handsome duo. That's us.
That's us, yeah.
That's
Although
us.
you make up more of the handsome part than I
No,
do.
no, no. I'm only a shadow.
No.
If a patient has negatively reacted to Lupron, would birth control be an alternative to pre-treatment for endo patients? What is the next best protocol for endo patients? No surgery.
Um, well, if you're talking about pre-FET, it would be either Vizan or Orilissa. If you're talking pre-IVF, it would be Vizan.
Hi, Superhero V and Sidekick T.
Oh, I like that one. That's good.
Not
I
bad.
mean, not that you're my sidekick, but
Yeah. I would prefer two superheroes, but I understand what they're trying to say. I understand what they're going. I know what they're going for. It's well intentioned, but I believe I'm a superhero in my own right. But that's hard to say it. But nonetheless, the question is: there anything you can do to help prevent preterm birth?
yes, aspirin helps prevent preterm birth. Not overexerting yourself helps prevent preterm birth. Not smoking prevents preterm birth, including marijuana. And taking progesterone helps prevent preterm birth. All of those are reasonable.
Hi, Dr. VNT. What factors other than age and lifestyle impact the euploidy? Does priming impact euploidy rates, testosterone only versus estrogen, and testosterone priming with DOR?
There's no evidence that I'm aware of that priming alters your euploidy rate. So I don't think that that makes any difference whatsoever. Age is a huge factor. Egg quality is a big factor. Sperm quality is a big factor. Um, the only other thing I've seen that's being reported but really did not work for us was delaying the timing of the retrieval from the time of the trigger. So there are studies that suggested that if you delay the retrieval till as far as 39 hours, you'll massively increase the number of embryos that are genetically normal. We tried just going at 37 from 36, and about 5 to 10% of our patients started releasing their eggs before we got to the retrieval. So we backed off of that and went back to normal, which is 36 hours for us. So there aren't a lot of things that will impact euploidy rates. It's mostly age. There are ways to improve it, which we're working on with this research project. It's a very cool idea, but it's not ready for prime time. We're just going to trial it, and it's complicated because it involves techniques that we don't normally use in the fertility world.
Best treatment for high NK cells and low trigs, tregs,
T-regs.
Tregs. Yep, that's the word.
Low T-reg would be lit. High NK cells would be intralipids, steroids. If you can get it, sub-QIG or IVIG. Plaquenil is also helpful. If you want to go cheaper, you can use vaginal Viagra. That's been shown to be beneficial. There's a bunch of different things you can use, but the main ones would be intralipids and steroids.
What's your thoughts on prepping for an FET with Lupron and doing probiotics to clear the microbiome together? Or do you recommend to wait to clear the biome first?
If you're going to test your microbiome, do it before you take the Lupron. Otherwise, you're not going to have a period you can't test. If you're not going to test the microbiome, you may as well do them at the same time. It won't make a difference.
We'll go to TikTok for a little bit. I get those questions through.
I
Hello,
can't
Dr.
see
V.
any of the TikTok. Oh, I should have screen shared.
That's okay, don't worry.
Yeah. Okay.
Hello, Dr. V and Dr. T. See, this is an individual that understands. I like that. What about your Ottawa location?
Oh, very keen. Kind of had a doctor, but haven't heard from them forever. So not yet.
They want you in
Working
Ottawa.
on it,
They want you in
but
Ottawa.
it requires me and another doctor, and I don't have that other doctor. So not yet. Yeah.
Maybe I should just
Although
roll up my sleeves and get in there.
I know, although I may have found a doctor for out west. So that might become a reality sooner rather than later.
Cool. Which
Mhm.
prog would you recommend for a natural cycle, PIO or crinone? Compounded doesn't work for me.
Um, I'm assuming they mean natural cycle FET. So if they're talking about a natural cycle FET, you want both oil, like injectable, and vaginal. So PIO for sure. And then I have to say, I like Crinone the best, but it's expensive. So not everybody can afford it. So, whether you're using Endometrium, which is a great product, or Prometrium, they're all good. Crinone, Prometrium, Endometrium, they're all good products. I have no problems using any one of those. The PIO, that's critical. You need that.
How's the back feeling?
Way better today. God bless you for asking. And I was finally able to get up this morning without agony. I'm still stiff as hell, but it's way better than it was. Way, way better. It might have to do with the fact that my son made fun of me all last night and I couldn't stop laughing. So laughter is good medicine. Yeah.
Laughter is
Yeah.
great medicine. I was going to say that. When should prog levels be checked in a natural cycle FET and what should they be?
Sorry, say that again.
When should prog levels be checked in a natural cycle FET, and what should they be?
Um, well, you would want to, well, it depends on whether or not they're giving you progesterone. If they're giving you progesterone, then you got to check it 3 days after they start the proj. If they're not giving you progesterone, you got to check it 2 days before you do your embryo transfer, and then probably again on the day of embryo transfer. So it depends on how they're doing it.
Do you think inositol helps PCOS fertility?
Definitely, there's good proof for that.
What are the best treatments for high NK cells for, oh, we did that.
We
Hi,
did.
Yeah, hi, Mr. T and Dr. V. See, even this one I kind of like a little bit because they addressed me a little bit earlier on, which is which is good sports, good sport. Um, could you please explain when investigating things like balanced translocation and karyotype testing is indicated and what it tests for, corrects, or identifies? Thank you.
Um, so we would check for translocations probably if you had a history of recurrent pregnancy loss, recurrent miscarriage, recurrent implantation failures without PGT testing, or if you did PGT testing at a relatively young age and had a similar um, genetic abnormality kind of over and over again. So what is it testing for? It's testing for whether or not your chromosomes are whole and intact, or whether pieces of them have switched over to another chromosome, or they've flipped over and reattached, or whether you're short a piece, that kind of thing.
How much prog do you keep on until 36 weeks?
100 milligrams 3 times a day if it's prometrium. Half the dose recommended for your FET.
We have a comment. I know I have time and not to worry, but I am. LMFAO. That's that's Carly. Does going in a hot tub affect male fertility?
Yes, absolutely it does. Heat is terrible for the testicles. So hot testicles don't work well. Hot tub, car seat heater, cell phone in your pocket, laptop on your lap, those are all bad. Avoid, avoid, avoid.
30-week loss cord accident, took 3 cycles to conceive, past
Oh,
3 cycles, TTC this time, went to get help.
it depends on your age, but I mean, I'm devastated for you. So just reach out and we'll help you.
Uh,
That's, I'm sorry.
please shed more light on when ovarian PRP is most beneficial.
Um, if you look at the studies demonstrate that there is a slight increase in live birth rates in patients that have taken ovarian PRP when they had very diminished ovarian reserve, like very diminished, basically people that are borderline menopausal. There's no question it's going to work better in younger women because older women aren't just in need of making more eggs, they need better genetics, and PRP does not help with that at all. So it's beneficial for a younger woman who has very weak ovaries who needs to make more eggs. For everybody else, you got to be very cautious in the PRP stuff because it's being oversold and overpromoted. And I actually had a consult from one of my colleagues today at another fertility clinic for doing PRP. And I told the lady, like, I don't actually know if this is going to work for you. You got to really think about this because she was still going to need a lot of cycles of IVF to make it work. That's not always a great idea for everybody. So PRP is ideal for the younger woman with weak ovaries. Will it work for other people? Yes, it'll help you make more eggs. But is it going to guarantee you success? No. And I know there is one fertility specialist in particular who has built his whole program around rejuvenating ovaries. It doesn't do that. It just doesn't. Like, if you look at the best study on this from Richard Scott's group, They studied, I think, 528 or something patients. It was just over 500 patients. And they had between a 13 to 15% live birth rate after ovarian PRP. If you take all of those women, and there was no comparison group, okay, so keep that in mind. This is a descriptive study. If you take all of those women and you just did one more cycle of IVF on them, you'd probably get 8% of them pregnant. So you're really looking at like a 5 to 7% increase in your chance of a live birth compared to just trying one more time. So don't be misled by PRP. Like, I use it, I think it's helpful, but I tell everybody, like, this is an incremental increase. You're going to go from making 1 or 2 eggs to maybe making 3 or 4. It does not improve egg quality. It does not improve blastocyst formation. There's no evidence it increases live birth for sure, although it's suggestive that it does.
Data is important.
Yeah, data is very important.
Wow, Carly Steele is here. I was literally just thinking of her. Here we go. FET on hold because doctor sent referral thrombophilia and doesn't want to try it until that. Would you wait?
Absolutely. Because if you need estrogen, you got to be careful because you could throw a clot. And even if you don't need estrogen, your pregnancy is at risk if you have a clot, and you are at a higher risk of forming clots when you get pregnant.
Did a Receptiva DX test in August of 21. Results were negative. Had a successful pregnancy after. Then had 2 implantation failures. Repeated test and result came back positive. What do I do with the results?
Nothing. It's useless. Ignore it. Don't spend any more money on Receptiva. It's a useless test. It's been proven to be useless. It doesn't predict anything. If you want to know if you have endo, go do laparoscopy. There's no way around it. There is no way around it. All these other tests, fake news. Don't do them. You're wasting your time. You're wasting your money.
Hey, Dr. V, what is the difference between the Fertility microbiome testing and the Emma and Alice microbiome test?
Emma and Alice require a biopsy. Fertility doesn't. Fertility has a better breakdown of bacteria and viruses, in my opinion. Um, Emma and Alice don't offer viruses. And they screen for more with Fertility, and then they break it down into the vaginal component, the uterine component, where it's high, where it's low. Is it normal? Is it not normal? I like the report better. I like the testing better.
Hi, what are your recommended supplements for low AMH?
Vitamin D, vitamin C, coenzyme Q10, melatonin. There is nothing else. I mean, those are supplements. If you want to get into hormones and stuff, DHEA, human growth hormone, testosterone, PRP, like, there are things that will improve it, but just in terms of supplements, it's very, very few. I don't know if you caught all those questions early on,
Oh yeah,
including including poor Yana, who's up at 3 in the morning with you. Or no, she's 3 in the morning also.
yeah, she's with me.
Uh,
We're very similar time zones this time.
yeah, you are. Do you want me to catch some of those?
Oh no, no, we gotta wait. We gotta make our way down. We got a bunch, but she's
Oh,
close. We'll get to her right now.
all right.
We'll end on her on this session. Hi,
Okay.
Dr. V. Has it been a journey? I just came off Lupron Depot with your protocol. My lining is actually going backwards. After I got off letrozole, Lindsay put me on 1 milligram, now 2 milligrams. I'm
Yeah.
currently waiting for a hysteroscopy due to thick endo lining. Day 10, lining is at 1.2. What are possible causes? I went into preterm 12 months ago at 21 weeks. Lining was normal before. Is there no endo has been found while lap? How fast can I do an FET? Thank you. Oh no, that's no. I ended on the pregnancy one.
Those are
Lining is normal.
different questions. Okay, let's take the first one. So, yeah, there are people who come off the protocol and their lining doesn't develop as well as we need them to. So we try a small amount of estrogen, 1 milligrams, 2 milligrams. If your lining doesn't respond, we stop. We wait for the next cycle. The benefits are all still there. We'll try again. You'll be fine your next cycle. Waiting for hysteroscopy due to thick endo lining. Day 10 lining is 1.2. That's a bit thick, but it doesn't matter. I would offer doing a saline infusion sonohystogram to make sure you don't have a polyp or a fibroid. But if you had preterm labor at 21 weeks, you need Fertility to look for infection, in my opinion. So the number one cause of preterm labor is either a weak cervix or infection, and infection is much more of a factor than weak cervix is. So I would be checking for infections embedded in your uterus, because if you treat those, you can avoid the preterm labor potentially. And then for our dear friend Yana, if there's no endo, how soon can you do an FET? Right away. If there's no endo, there's no reason to wait. So just go right into your FET.
Doctor, please, how can I book for appointments?
www.drvictory.com and ask for a consult, or contact us by phone number. It's on our website, or get your family doc to send a referral if you're local.
Can 30 days of Clomid 50 milligram medication help increase fertility in men?
Yes, you can even do it 25 milligrams every day. That's what we normally use. But it depends on what the male's hormones are like. And 30 days is not enough. It needs to be at least 75 to 90 days.
I get pregnant by Clomid, but in the first 3 months, I lose my baby. That's it.
Yeah, and she has another one. She said, I lost my 4 pregnancy in first trimester. Please tell me what I need to do from UK. You need a whole bunch of testing for recurrent pregnancy loss, genetic testing, sperm testing for your partner, DNA fragmentation, vitamin levels, saline infusion, sonohystogram, thrombophilia screen, a whole recurrent pregnancy loss panel, fertility testing, genetics, karyotyping. Like, there's a lot you need to do. I love the fact that they're watching from the UK. It's 2 in the bloody morning in the UK. It's
You
crazy.
know what? For solid information from a reliable source, I would even stay up. What time is it? 3:30. I would be up waiting for this.
Do you remember our first show? I think we had 12 views.
Yeah, I do remember it. I do remember the grind. Absolutely.
I think we get 5,000 now. Like, it's
Oh,
insane. It's crazy.
wild. Today's a good
You
show
know,
as
it's
well.
completely bonkers. Yeah.
Embryo glue. Any
Yeah,
evidence it makes a difference?
absolutely. Randomized controlled trial evidence, meta-analysis evidence. We use it in every transfer. We include it for free in all our transfers. Now, we didn't originally, we were charging for it, but then we realized we could do it reasonably cost effectively if we did it for everybody. So now we just do it for everybody.
Is there a difference between the trigger shots superfact and decapital for retrieval?
Oh, Decapeptyl?
Decapeptyl.
No.
Nice and easy.
Yeah.
Here we go. Family doctor also refused to treat my ureaplasma. I'm desperate. Is it the same person from last time? We don't know.
You know what? Just contact our office and we'll figure something out. Yeah.
Hello, Dr. V. Would you consider 28 to be elevated prolactin, and would you treat if egg quality is a known issue? Tested 3 different times, fasting, no intercourse, etc. Negative brain MRI, have endo.
Oh my God, who ordered an MRI on somebody with a prolactin at 28? That's
Wild.
insane. You're not supposed to order it until it's like over 100. No, 28 I wouldn't even consider elevated. And you need to have like prolactin done between 8 and 9 in the morning. And then you need to have a monomeric prolactin done as well to make sure it's not macroprolactin that's artificially elevating your prolactin. Even if it was monomeric at 28, it's barely elevated enough to treat. And I certainly would order an MRI. That's absurd.
Here we go. TikTok. Uh,
TikTok.
have you ever put someone on Clomid and letrozole at the same time?
I haven't. I've seen other people do it. I haven't seen any studies on it. So I haven't done it. It doesn't make a lot of sense to me either. Like I've tried to rationalize the physiology there. I don't see why I would do that. It doesn't make sense.
Avoid car seat heaters for women too.
Um Unknown. No one's ever looked at that, but they do emit electromagnetic radiation, so it's probably not ideal. See,
Beta
now
is
my back is twinging from sitting for so long. Oh,
yeah, yeah.
okay. I'm listening. Go.
Beta is 194 at 4 weeks. Is this
Yeah.
normal?
194 at 4 weeks.
Hmm.
If it's your first test, yes. So it could be. Depends on exactly what you're doing, but yeah, it could be. Depends on your age too, right? Remember that older women have lower betas, so there's a lot of factors that go into that.
What do you think about the use of saunas or sauna bags for male female fertility?
Terrible. Yeah,
I,
heat is bad for your fertility. What's a sauna bag?
I don't know. That's a new term.
Somebody out there explain to me what a sauna bag is.
I'm
It's
betting
not
it's a
like
bag
you
of steam.
maybe you yeah you and they pump in the steam. I don't get it. Or maybe like you go in a bag and you like cinch it and then they pour in the steam or something. That would be like I would never let someone do that. You'd like burn in seconds. Yeah, no, I'm not into I have no idea what a sauna bag is. Somebody send a picture somehow. I gotta see what a sauna bag is.
I'm
You
sure
know,
you
you
will.
and I learn something hilarious from this show every single time we do.
100%. 100%. I was actually thinking of that exact example last time.
Oh goodness. Okay, next.
Um, HSG shows biproximal blockage. Lobulated U cavity. Hysteroscopy shows normal cavity. Is the HSG wrong?
Well, hysteroscopy is the gold standard because you're actually looking at what you need to see, but it won't tell you if your tubes are open. So the tube part, you'd have to figure out either laparoscopically or hysterosalpingogram. But the shape of the cavity and the formation of the cavity, nothing's better than hysteroscopy. That's the gold standard. You're actually looking at the inside of the cavity.
What else would you suggest other than donor egg for a 45-year-old trying to conceive?
I'd need to know your history. I mean, we go through detailed history with patients. It's not that there aren't options. You can always try your own eggs. You got to understand the math. Your chances of success are, in the best case scenario, like 5 to 10%. I mean, it is super, super hard to make it work. Now, if you're wealthy enough to manage it and you are happy to try, and you don't mind the fact that you're going to have to do it a lot, yeah, sure, give it a shot. But if you're worried about the costs, if you're worried about the invasiveness, if you're, not happy with the fact that a 2 foot long needle is going to be put inside you multiple times, you got to consider the alternatives. But there are ways to make the ovaries stronger. People have been talking about PRP. It helps a little bit. Testosterone priming helps. DHEA helps. Human growth hormone helps. So there are ways to make it work. It's just, it's challenging. You probably need 45. You're probably talking 95% of the eggs are going to be abnormal. You need probably somewhere between 30 to 40 eggs in order to get one genetically normal embryo. Like you're going to need a lot. Maybe not that many every time, but you're going to need a lot. So it's tough. It's really tough.
Do painful cramps mean infertility for women?
Painful cramps can be a sign of endometriosis, which can then cause infertility, but they're not one and the same. Like, not every woman with cramps has endo or infertility for that matter. So it all depends on what's actually going on, but I wouldn't ignore it either. I talk to your doctor about it, and this is critical, make sure your doctor takes it seriously and actually investigates whether or not the cramps are related to anything. Because on average, it takes women 4 to 7 years to get diagnosed with endo because we do such a crappy job of actually paying attention to them. So that's why I've kind of built my career on making sure I listen to my patients and taking it seriously and offering them evaluation. I hear day after day people saying, they didn't get investigated.
What do you recommend to get a natural period?
I need to know the background. I can't answer that. Depends on what's wrong. PCOS, diminished ovarian reserve. It all depends on what's wrong.
30-year-old with egg count of 5. Is it worth trying for egg retrieval?
30 years old, egg count of 5?
Mm-hmm.
Absolutely. Yeah, sure. I mean, that's not your only option, but it's your best option. And yeah, for sure, it's worth it. You got a very good chance. At 30, 25, 30% of your eggs will be genetically abnormal. If they can get all 5 to be mature, your egg quality should be decent. You'd have a very good chance of getting a couple of normal embryos. You're golden. Yeah.
I'm a patient of yours. Do we need another referral for transfer of second baby?
Depends on how long it's been, but contact the office and they'll tell you what to do.
All right. That was a block of TikTok. We go to.
I can't tell if Soraya's there, but if she is, hi, Soraya. I know Carly's there. Carly's a faithful. Hi, Car.
Shraya's on strike today, it looks like.
Is she on strike today?
She usually shows up with her sheep. You know what I mean? I haven't seen the sheep yet.
The sheep are hilarious.
The sheep are hilarious. Hello, Dr. VNT. Infertility group. I read some ladies in their 30s and 40s who have had ovarian PRP happened to have high FSH the next cycle. Any thoughts on that?
I have not seen or heard that, but if the PRP is not done properly, you could damage the ovaries, and certainly that would be a problem.
What is the most successful priming with diminishing ovarian reserve? Thank you.
DHEA, testosterone, and human growth hormone. Lots of supplements, probably acupuncture, stuff like that.
My doctor advised me a egg donor AMH 0.08 and FET successful own egg last year. I'm 41 years old. I don't know why my AMH is so low.
Face blue, wide eyes. I don't know what that means.
It's like a sad face, I think. Sad face.
I mean, it would definitely be difficult at 41 with an AMH of 0.08 to get you pregnant on your own. Not that it's impossible, but it is difficult. As for why your AMH is so low, I would need to know your history. Do you have to do an egg donor? Not if you were successful last year. There's options, but we'd have to know your full history to help you out better.
Hello. I recently had a miscarriage at 8 weeks. 3 months ago, had to take a pill and have been bleeding ever since. What could be the cause of this? HCG and ultrasound was clear.
I would be worried that you're still retaining tissue. So make sure you get your hormones checked, and not just your HCG, like your thyroid, your FSH, your LH, your, all your hormones, your prolactin, and then do a saline infusion on a histogram to make sure there's no tissue retained in there.
32 female AMH of 9, normal HSG, first OI cycle resulted in ectopic pregnancy with a
So,
salpingectomy. Second and third OI resulted in early losses. Do you think IVF is the best option or keep trying OI?
well, you're succeeding with the OI, you're just miscarrying. So I would want to know why. So check your partner's sperm, make sure no one's smoking, drinking, drug use, check your body mass index, your partner's body mass index, DNA fragmentation, check the shape of your uterus. I mean, there's a whole host of things that could be looked at, infections, immune stuff. I wouldn't jump into IVF if you've been pregnant already 3 times with just ovulation induction. Save yourself a ton of money. Find out why you're miscarrying first. IVF does not necessarily always solve the miscarriage problem. There are lots of people that get pregnant with IVF and still have miscarriages. So, first find out why you're miscarrying, then determine what treatment will get you safely through to being pregnant and staying pregnant.
At age 40 with an AMH of 22, BMI 29,
Wow.
is is it best to lose weight before egg retrieval and FET?
No, not at that BMI and at that age. Go for it. I mean, go for your retrieval. Once you've done your retrieval and you have normal embryos, sure, it'd be great if you could lower your BMI a little bit, but you don't need to do a lot. But then your embryos are frozen. Don't wait for the retrieval for sure. It's a great Chinese study we reviewed on the show, I don't know, probably 2.5 years ago, which showed that it's much better to, over the age of 38, to go straight into the fertility treatment rather than trying to lose the weight, because you actually have to lose a lot of weight once age becomes a factor to counteract the effect of the age. So it's better to do the treatment first, make all your embryos, and then if you want to lose the weight, go ahead and lose the weight.
Hello. What is the patch protocol? My wife has had my wife has mild adeno and 2 failed FETs. Our doctor wants to do the patch protocol for our next FET with micronized Lupron.
So it's just giving you estrogen as a patch, which is a bad idea in my opinion if you have adeno. So talk to your doctor about alternatives. Like we would put you on a endo protocol or adeno protocol, which does not involve estrogen if you can avoid it. Yeah, I mean we sometimes need estrogen, like our other viewer who's not responding well without it, but you want minimal estrogen, not patch doses of estrogen.
Medicated FET. Does the type of progesterone matter? Suppositories versus PIO, one better than the other.
Yeah, we've reviewed that on the show too. It's much better to have PIO and vaginal, but if you have to choose one or the other, it's always the PIO. That's been proven time and time again.
Please help me. It's going to be my 6th year of my marriage and 27-year-old. I had 4 miscarriages. What I need to do now?
That's the stranger one who from
Yeah,
the
the stranger
UK.
one. Yeah, the
You
stranger
need
one.
you need to reach out. Like you need a lot of testing. Um, you may have a hard time getting it done in the UK. The UK has a very reluctant and hesitant program. I may actually be able to finally get my UK license. I actually found that out today. So
Oh, congrats.
yeah, yeah. So yeah, you need testing. There's no question. So stranger one, you should probably do a consult with us. Then you need testing, and then we can figure out what you need to do to help yourself. But you need testing, and your partner needs testing. Don't just keep having miscarriages. That's not healthy.
My doctor advised me an egg
We
donor.
did we did that one.
Okay. Uh, my OBGYN doesn't want me to see a fertility specialist. Oh, that's a great start to a question. Because I got pregnant naturally after a year of trying, but miscarried early. Do I need to see another OBGYN?
um, yeah. Yeah, yeah, yeah.
I think even when they asked that question, they also knew the answer because technically they're already asking you already. You know?
Yeah. Yeah. You're already getting another OBGYN involved. Yeah. So that's a good point. So yeah, you need another OBGYN. You should see a fertility specialist if it took you a year to get pregnant and then you had a miscarriage. Like, of course you should see a fertility specialist. There's no reason not to. Why would
Well,
the OB tell you no? Like that makes no sense.
some doctors special.
Oh, I could tell you a good one today, but I'll have to tell you in private. Oh, it was a winner. It was a referral from Emerge, and wow, missed the mark by that much.
Oh wow.
Yeah,
Oh wow.
yeah.
Uh, does ovarian PRP actually improve live birth rates?
We don't know for sure. There is one randomized controlled trial which says it increases egg count and blastocyst formation. There is a descriptive study which suggests that it increased live birth rates. There is no randomized controlled trial proving that it increases live birth rates, though. So we don't know yet.
Should probiotics be taken in conjunction with any rounds of antibiotics? If so, what dose or brand would you recommend?
I try and steer clear of telling people what brand or dose of stuff to use, but our pharmacy promotes NFH. I have no idea why, but they like NFH. I like the cosmetics of it. The bottles look pretty. Like, I don't know. But the product they have is called Flora. So that's the one I'm most familiar with. Should it be taken in conjunction with antibiotics? 100 million% yes. Because as you're killing the bacteria, you need to replace it with good bacteria. And the antibiotics will kill the good and the bad. So you need to flood the good so that there's constantly good bacteria to replace the bad.
When you recommend DHEA or egg quality, any downsides or contraindications?
Hair growth and acne, very few contraindications. Liver disease, severe high blood pressure, steroid problems, stuff like that.
Is it worth it to have my husband do DNA fragmentation testing when we've had multiple miscarriages? His sperm tests and mobility come back normal.
DNA fragmentation is independent of the other factors in the sperm test. And if your husband has high sperm DNA fragmentation, it's up to an 11 to 12 fold increase in your risk of miscarriage. So is it worth it? It's like 100 million% worth it. Of course it is. It's one of the first tests we do when we have couples with recurrent miscarriages.
Hi, Dr. V and Tarek. Ah, that's also good. Immune question. My 50 to 1 NKASSAY is 33. With
My what?
my NK assay
Yeah.
is 33.
Oh, okay.
With interlipid, it's 18.4.
Okay.
And my CD56 is 7. Do
Okay.
you think I need IVIG to get my NK assay down? They don't do SCIG in the UK.
Probably not. I would try steroids first. I mean, IVIG is so bloody expensive. Yeah.
Ozempic babies are all the buzz right now. Has there been any research showing that these weight loss meds can help patients with infertility once BMI gets lower?
Um, Not directly, but it's obvious. I actually was laughing because all my social media colleagues are making a big deal out of Ozempic babies, and like one of them got interviewed and the whole thing, right? It's so silly. Like, we know that if you lose weight, your fertility improves. How you lose weight is irrelevant. If you lose weight, your fertility improves. So whether you're doing it with Ozempic or diet and exercise, if you lose weight, your fertility improves if you're struggling with your weight. It's not like Ozempic makes you more fertile. Weight loss makes you more fertile. So they're not Ozempic babies, they're weight loss babies. Yeah. Is Ozempic helpful? Absolutely. It's great for lots of people. It also can do a lot of damage. I talked to someone the other day who needed a midline laparotomy, up and down cut open, because they got paralytic ileus where their bowels stopped moving, which is one of the side effects of Ozempic. So it's not for everybody, and not everyone should be using it without, a lot of consultation with their physicians. Don't just jump on Ozempic. Talk to your doctor.
Do
Weight
follicles
loss is
continue?
always good.
Do follicles continue to grow after trigger shot?
A little bit. Yeah, a little bit.
Is it safe to do an FET a week after a Lupron shot?
Um, Not usually, but it would depend on what kind of Lupron shot and why it was being done. Yeah.
What are the best treatments for high NK cells and low trigs IVIG?
Well, IVIG is the best, but it's so bloody expensive. Not everybody can manage that. So intralipids, steroids, possibly heparin a little bit. Plaquenil is useful. Vaginal Viagra can be helpful. So those are kind of the mainstays of treatment right now for us, now that sub-Q IG is gone. IVIG is the best, but it's like unmanageable for the vast majority of people.
38 and a half years old, AMH 0.5, endometrioma on each ovary. RE doesn't want to remove endometriomas because she says the surgery will destroy my reserve. Wants to start IVF ASAP and do a 3-day fresh transfer. Thoughts?
Excision of your endometriomas will probably damage your ovaries, especially if it's not done by an expert. You will see a decline that is temporary, usually in ovarian reserve. So I'm not sure that. Okay, T?
Yeah, I'm good.
Oh, something was happening there. So I'm not sure that that's a great idea. So I kind of agree. Do you have to do IVF immediately? No, but your ovarian reserve is very low. And unfortunately, with endometriomas, you're damned if you do, damned if you don't. The endometriomas themselves weaken the ovaries, something that's commonly ignored. So the presence of the endometrioma makes your ovary weaker. So yes, it's not great to remove them because that also makes it weaker, but leaving them there doesn't help you either. So I think IVF is an option, and certainly it would be worthy of consideration. Day 3 fresh transfer, I would absolutely disagree with. I think that's nonsense. We know that patients with endo have higher rates of aneuploidy, and we know that fresh transfers have the lowest chance in someone with endo. So that makes no sense at all.
Good day, T and Dr. V. 35-year-old female with no male factor. Seems to be tubal factor only. Got pregnant on our second FET. Preterm birth at 23 plus 3 weeks due to large chorioangioma.
Chorioangioma.
Chorioangioma. Yeah. You know, it's like almost 4 a.m. here. Some of the words are starting to blur. Have since tried 2 FETs, 1 failure, and 1 chemical. We have 8 untested but
Wow.
well graded embryos left. Would you recommend making more embryos and PGT testing or just keep trying FETs?
No, I'd recommend you figure out what's wrong. So speak to your RE or reach out to us, figure out why you're having the failures. So 35-year-old, 50% of the embryos should be normal. So it would be odd that you had the chorioangioma in the first one, and then even more odd that you had 1 failure and 1 chemical. So I would chat and figure out what's wrong. It's possible there's something else going on, an immune problem, an infectious problem, progesterone problem, endo, whatever the case is. but I would investigate further to figure it out.
HSG shows no 0.
What?
That's what I got.
Yeah, I got nothing, man.
Okay, I'll continue. Sometimes you're able to put these things together.
HSG shows no 0.
That's what I see. Shows O, shows no O. I don't know.
Maybe not open.
I don't know.
No idea. I can't see that question wherever it is.
It's a
Is that a
TikTok one.
TikToker?
Yeah, that's a TikToker. Yeah,
Oh
yeah.
yeah, I can't see TikTok.
Just got ANA blood test, came back positive with a reading of 1 to 80. Is this
Oh,
concerning for fertility?
it can be. You probably need to talk to your doctor about going on aspirin and heparin.
What about low dose HCG after FET to help with implantation and placenta support?
It's useless. It's proven to be useless. Lots of
30
stuff. No
30 year
benefit.
old, oh, sorry.
No, it's good.
30-year-old smoker, egg count of 5. Isn't it worth trying egg retrieval? How many eggs would I get?
30-year-old egg count of 5.
Yeah.
That's the one you asked earlier. I mean,
Yeah, I think they gave the information that they're a smoker. I think that's the new nugget.
yeah. Um, you're still going to get a reasonable number of eggs, hopefully. Don't smoke, but you're definitely going to get a reasonable number of eggs. You probably get 4 or 5. It's getting close to 9. And
Yes.
I must say, we have a new comment here that we've never had before that I have to read because it's so stupid. It says, "All hail our dark lord Satan. Hail daddy Satan." Where do these people come from? It's a fertility show, for God's sakes. Like, where do these idiots show up from? I have no idea. I
That's
think
on
you need,
TikTok or here it is. Yeah, yeah, on YouTube here.
yeah. I don't believe in Satan, and I believe that no one should be hailing Satan if we did believe in him. I think we've got enough unbridled evil in our world these days to maybe focus on some of the good instead of the bad. So, how about we focus on helping people like we're trying to do here instead of the nonsense that you're spewing like a, I don't even want to say it. Anyways,
There you go.
onwards. Yeah,
Onwards and upward.
onwards
Uh,
and upwards. Yeah.
Thoughts on artificial oxytocin activation liquid for poor egg quality. Last retrieval were 0 blasts.
Um, ionophore oocyte activation. Is that what it said? Or inositol? I didn't hear what you said.
It actually said artificial oocyte
Oocyte
activation.
activation. Yeah, we use it all the time. It's great. I love it. And there's good enough data to support using it.
32-year-old first beta was 197.
32. Oh, that was the one that said 197 earlier
Yeah.
on 4 weeks. Yeah, it could be normal.
Uh,
Yep.
can
Wait
I
48 hours and test it again.
can I unfreeze my eggs, make embryos with my partner, and then freeze them again? Is there a risk?
No, that's fine. That's done routinely.
Does
I mean,
having a
ideally, you would do a fresh transfer, but you can refreeze the other ones.
does having a hysterectomy leaving ovaries affect your egg quality?
No, but it'll diminish your ovarian reserve slightly.
HSG shows no proximal block, lobulated UCAV,
We did that.
hysteroscopy. Oh, did that?
Yeah.
H hysteroscopy shows no normal cav. H is Z wrong. We did that one. Yeah. Does clear cervical mucus mean you have good fertility for women?
No, it's nonsense. All that cervical mucus stuff is garbage. Don't buy into that. It
How long?
means,
Yeah. How long should I get off birth control before trying to start conceiving?
well, you're technically fertile immediately, but the average is about 3 months for your fertility to return to normal. I got to answer Yana's question.
Go
If there
ahead.
are absolutely no symptoms of endo, what are the odds you have silent endo? 44% if you have unexplained infertility. So for patients with unexplained, it's a 44% chance they have endo. Last question, because I'm
Uh,
starving at dinner.
yeah, sure. My husband was born with a tongue tie. If my baby has it, can they clip it at the hospital?
Oh yeah, absolutely. That's easy.
There's so many questions. There's a whole conversation that developed on TikTok. Just trying to make sure.
On
So,
Hail Daddy Satan or
no,
on
no,
some.
no, no. There's a whole thing going on. I was just trying to find where I left off on the questions. I'm your patient and you're the best doctor. I mean,
Oh,
how many rounds of IUI would you suggest for someone with no male factor and PCOS insulin resistance?
depends on age. Less than 38, up to 6. Over 38, maximum 3.
Does it take a while to get pregnant with celiac? I have been trying for the last 9 months or so.
It can. Celiac patients, there actually is some evidence that it's harder for them to get pregnant. So yes, it's possible.
How does antiphospholipid antibody syndrome impact pregnancy?
It causes an increase in microvascular clotting. So as the placenta is implanting and creating blood vessel supply between baby and mom, it plugs off the little blood vessels and it prevents the placenta from functioning properly.
Does having a hysterectomy and leaving your ovaries affect your egg
It,
quality? Did that?
it's 4 in the morning for you, buddy. You're starting to lose it.
People repeat their questions. People get
I,
they lose hope and they
I
hope they give
in
up.
in the interest of my stomach not eroding a hole through my abdomen and Tarek actually getting to eat before he has to fast, we're going to bring the show to a rapid close. I'll take a couple of rapid questions here. Would intermittent fasting help fertility? Yes, it does. There's studies on that. I have PCOS, bicornuate uterus fibroids. How can I increase food healthy eggs? I don't know the food part. You need a fertility consult. There are ways to help you. There are supplements that can improve your eggs. If you're heavy, you can improve your eggs by weight loss. There are medications that can help. How can you improve low motility sperm? Normal labs, vitamins, frequent ejaculation, cold therapy, and no smoking, no drinking, no drug use, avoid heat. And check out our video on YouTube dedicated to how to improve sperm. Anna, we answered. Hey, I have 2 daughters from previous marriage. I'm 32 years of age with my husband. I've had an ectopic pregnancy and a miscarriage. I have PCOS, underactive thyroid. Please advise, what can I do? Whew, that's complicated. I would need to see you and figure out what's wrong. So I can't answer that easily, Nafisa, but contact us and we'll help you. Okay, I gotta go. Tarek's gotta go. We gotta let him eat. Yeah, that's it. Everything. Oh, one last question. Could an egg be viable on the 44th day of your cycle? Tarek, you want to take that one?
I was reading the comment section in TikTok. There's like a little battle royale going on here.
I can't see any TikTok. You're gonna have
Yeah,
to
today's the day you
screenshot it
missed
for
out.
me.
Today's the day you missed out.
No, an egg will not be viable on the 44th day of your cycle. In all likelihood, it'd be a terrible quality egg. Okay, have a good night, everybody. We will look forward to seeing you guys again soon. Thank you all for watching. Thank you all for your incredible YouTube support. T, I don't know if you've paid attention lately, but our show video gets 1,000 views within like a week.
Yeah.
Last time it got 1,000 views in a day. So there's a lot of people paying attention, which is great. I hope you guys all have the best journeys and the best of luck. Lots of interesting things coming up in the near future for us. We will bring them to your attention when we know that we can and we know that they work. God bless all of you. Tarek, be safe. I love you, buddy.
Thanks.
And to my wonderful family, thanks for putting up with me not being home enough. Love you guys. Everybody take care. Peace out. T, get some breakfast.
All right. Take care.